My name is Dr. James Thomas. In this video, I'll be talking to you about the NHS Diabetes Prevention Programme, NDPP. We'll discuss what you can do to increase referrals and give you some top tips to make sure no one falls through the cracks. The NHS Diabetes Prevention Programme is a behaviour change programme that helps those at risk of developing type 2 diabetes greatly reduce their chances of getting the disease. Taking part means you receive support to change your lifestyle in a friendly and supportive group environment. Sessions are facilitated by specialist staff trained in behaviour change and diabetes prevention and recruited from local communities. There are 13 sessions, either by video or telephone, and there's a digital option too. And face-to-face will return in the future. You can refer patients who are aged over 18, are not pregnant, have never been diagnosed with type 2 diabetes, have an HbA1c in the pre-diabetic range 42 to 47 millimoles, or a fasting plasma glucose of 5.5 to 6.9 millimoles per litre within the last 24 months, have a history of gestational diabetes mellitus, GDM. If a patient meets the eligibility criteria, you can refer them there and then by completing a referral form on the clinical system. This is the preferred way of referring. We've produced a guide to help you identify these patients. Anyone with access to clinical systems is able to make a referral in this way. You can also target large numbers of patients at risk with a mail out to invite them into the NDPP. We've produced a how-to guide, including template letters to help with the mail out and keep on top of the referrals. It saves your time too. Patients contact Read Wellbeing themselves. All the details they need are in the invite letter. This includes the blood tests and the results. Many practices have had real success by conducting a mini mail out once a month, targeting newly diagnosed patients. Here's the kind of things that people say.
I'm not as mobile as I used to be and was worried that my weight was creeping up. So I reduced my portion size. That way I could still eat everything I liked, just less of it.
Well, staying healthy ain't about fad diets. I attended the Healthier You programme and you didn't get preached at and everything was easily doable.
Talking out loud and writing down everything I ate helped me realise where I was going wrong.
Here are some top tips, all tried and tested by your fellow GP practices.
Nominate a practice champion to run a search once a month and invite patients at risk. Get your social prescribers, wellbeing coaches, link workers, health champions and support workers on board.
Make a referral in the moment while in a consultation or health check, or if you are recalling patients for bloods. This could also include patients that have been recalled for a blood test in line with the non-diabetic hypoglycemia indicator QOF. We know that patients are much more receptive and probably more motivated to access help when in the presence of the healthcare professional.
And finally, remember, by inviting or referring eligible patients, you will help them to access the tailored and personalised support they need and reduce their risk of developing type 2 diabetes. There are lots of resources and guides which you can refer to for more information. We've included some of these on the screen.